Are you feeling pain in your legs, especially after dealing with the blood clot? Well, you could have the venous disease, and Dr. Sharma of Arizona Vein and Laser is here to tell us how he can help relieve that pain. And let's first talk about what the venous disease is. I mean, I've been bringing it up and everything. Let people understand a little bit more what that is about.
The veins are supposed to carry the blood back to your heart. And if some of the veins are not functioning well, that means they're not carrying the blood back to your heart. Then the blood starts pooling in your legs. Let's, for example, say legs. So, in the legs, the veins are not working, the blood is going to pool there. It's not going to flow.
Right.
So that pooling will cause swelling, heaviness, or tiredness, achiness, cramping, so many things it can do.
Right. And we know we see this for people who have blood clots because I'll be a perfect example. I had blood clots in my legs. The doctor said that some of my veins were damaged because of that, and I will start feeling pain here and there. Not to worry too much about the blood clotting, it's more about that pain from the vein that you can take care of.
It's all conservative treatment for the blood clots. And after the blood clots heal, there is some scarring in the veins. Those are the main big veins in the legs. And those scarring will cause some pooling of the blood. The treatment for this situation is wearing compression stockings.
Perfect. And I like that because I have them on right now. So let's talk about what you do to help relieve the pain, which is pretty much a kind of like the in and out kind of procedure, right?
That's right. If somebody comes to me with these symptoms, or one symptom or maybe many symptoms, we do an ultrasound and check out what veins are not functioning. Then I explain to the patient with the help of pictures or diagrams that this is what you have and this is how we are going to treat. We can treat the veins. The treatment is basically closing the veins down because we cannot repair them. So we can use either a chemical or a laser. Everything is done with a local anesthetic. There is no incisions. The procedure in my office takes about 10 minutes to do for one vein. And after that, the patient just walks out of my office. They can drive, they can exercise, they can do everything.
Wow, that's amazing. And also, I've been out to your office, the one out in the east, in the West Valley.
Yes.
It's so comfortable. It's so amazing how you do take care of your patients and how even after the surgery, you guide them to making sure that they stay healthy and that they continue to be able to walk without pain and to be able to move a little bit more.
Absolutely. And the care after the treatment is basically the patient has to be educated about how to take care of themselves.
Yeah.
The disease process we can't stop, but we can slow it down because it's all hereditary.
Right.
That these veins become bad with time.
Yeah. So if someone's at home right now, probably watching and feeling that pain and probably much going, well, I have dealt with it all this time, you can guide them through again, saying, come see me, come talk to me, give a call, because you want people to feel comfortable. You want them to be able to walk. You want them to spend time with their families, because that's what happens with this disease is that they stop going and doing things with the grandkids or even, the men, when they want to work out. That's the thing too, right?
Unfortunately, many patients, they feel that growing old is the problem. And their PCP or somebody has not guided them in proper direction. Once we do the treatment, that difference they feel, they say, why didn't I come to you 5 or 10 years ago?
Yeah.
So that time they lost. So once they feel better, they start being active again.
So I like it. Doctor, I'm so glad you came in and talked to us, especially right now as we're starting to get back to some nice weather. People are going to get outside. You want to make sure you relieve that pain and swelling. And one way is visiting Dr. Sharma's team over at the Arizona Vein and Laser. We have information on aztv.com. We have a page there you can go to find out more. So, Doctor, thank you very much.
Thank you.
So.